Okay, my name's Erika, and I'm going to be doing a nutrition-focused physical exam on my roommate Delaney. I'll act as a dietitian, and she'll be my patient. So, hi Delaney, I am your nutritionist, and I'm going to be performing a physical exam on you.
Okay.
So first step is to examine your hair, and while I examine it, I wash my hands, and I'm just going to be looking for any bald spots in your hair, and I'm going to tap this just a little bit. Tell me if it hurts too much, just to make sure no hair is falling out. But everything looks good. Now that I've examined her hair, I'm going to go and examine her eyes. So what I'm going to do is I'm just going to look underneath her eyes and check for any hollowness or any discoloration. And then I'm going to go around her temporal lobe and just check and see if I find any fat loss or any extra skin around the head. It all looks good. My next step normally would be to get a flashlight and check her eyes to see if there's any deficiencies, if I could tell from the discoloration of her eyes. But I don't have one today, but normally you would just have them look in the 3 o'clock direction while pointing the flashlight, and then in the 9 o'clock direction. And now that I've assessed the eyes, next would be the mouth area. So what I'm going to do is I'm going to ask the patient to smile at me and see if there's any difficulty with that. All looks good. Beautiful smile. And then next what I'm going to do is I'm going to ask her if she has any swallowing difficulties.
No.
Okay, so she says she doesn't, but normally if she does, then we would do some other tests. We could do the putting your finger against her throat and seeing if you can feel the swallow that goes all the way down. I could also ask her a few questions like, can you make a fishy face? Can you make a puffy fish face? Perfect. And then another thing that you would do is you can place your hand underneath their chin and ask them to open their mouth and see if they have any difficulty with the little bit of pressure that you're applying. And then the last thing that I would do is normally, again, with a flashlight, I would have her open her mouth and I would check inside her mouth for any sores on her tongue or on and around her mouth or anything. So along with the mouth, next I would ask some questions about her lips and her teeth. So I would look at the patient and I would see if her lips are very moisturized or if they're more cracked. From my patient, she seems to have very moisturized lips, no cracks on them, but if she did, I would ask if this is something that's just recently been happening or if it's always been like this for her. And then we'd move on to the teeth. And I would just go ahead and look and see if she has any missing teeth. And if she were to, I would ask how the missing teeth have affected her eating. Can she chew very well with it or is she struggling with it? And then further from there, you can assess, just ask lots of questions about how the patient is with it. Okay. Next, we are going to be examining the patient's clavicle and their arms. So for the clavicle, all you're looking for is you can try to look at it straight on and look at both sides and see if there's any deficiencies and gaps in between. It looks really good on her, but normally you just make sure you're checking on both sides, not just one, and seeing if there's any gaps in that. As for the arms, you're just gonna look at right here and just make sure on the deltoids that there's no, again, muscle wasting or anything like that. And then next I'm gonna have the patient stick out her arm and push against one of my hands. And I'm going to feel for the scapula in the back. If it were to be severe, you would feel there's a shelf to hold onto it. But as for her, it's pretty sturdy. I'm going to try it on both sides just to make sure each side is even. Yep, very good. And then I'm going to have the patient put her arm in an L shape like this. Yeah, like this. There you go. Sorry. And then I'm just going to feel down and feel the skin here to make sure that I can't feel it like I'm feeling through paper. Just to make sure there's no fat wasting there either. And I'm going to do it on both sides again. And looks good. And so then the next will be okay. So for the nails, I'm going to ask the patient to have their hand out and I'm going to look at their nails and for her, she has her nails done today, but normally for a patient, you would look at the shape of the nails, seeing if they're spoon-shaped or if there's any ridges in the nails. You can also squeeze the tips of their fingers and check for their capillary refiltration. And as for her, she has it really good. But all of those things would just have signs of deficiencies in all certain areas depending on the symptom that you would see. The other thing I would look at is her skin. Just right off the bat, I would look at any discoloration in the skin. But one good thing to always check for like dehydration is you can pinch the skin and see how long it takes for it to come back down. If it takes a long time, it most likely means she's dehydrated. If not, like today, like she's pretty well hydrated. So another thing that you would look at is the hairs on the arms. Just the different types of hair, like corkscrewed hair or like raised up hair, can show signs of deficiencies. So you just want to look out for those. So the next step we're going to do is look at more of her lower body. So first, on my way down to the lower body, I'm going to check her ribs and see if there's more fat around it, or if I can really feel her ribs. So I'm going to do both sides and feel, and everything feels normal for here, but you just want to check if there's any fat or muscle wasting around the waist area. Next, you're going to move on to the legs, and you're going to want to measure it. Some people have ultrasounds that you can do mid-leg to check for the amount of muscle, but obviously today I don't have that. So normally I just look at the quads and make sure that each are even and there's no visual deficiencies that I can see off the top, like just from my eye, like any like fat wasting or anything. And I'll also go ahead and feel her calf and see if there's any wasting on either leg as well, just to make sure for any, again, just fat and muscle. Okay, lastly, we're gonna check for, one of the last few things we're gonna check for is edema. So while I was looking at the legs, I would ask the patient if they were lying down, I would do it, but if she's sitting down, I'm just gonna take my hand on either side of the leg, and with my thumb, I'm going to press down for 5 seconds, and then I'm gonna look and see if I still had a dent in the leg, or if it immediately replenishes, then that means there's no signs. But if it took a while, you can identify it in each stage of edema, just depending on the look of the dent that you just made, and that just assesses their fluid status. Next, I'll do their assessment of their GI. So normally I would take a stethoscope and I would listen to all her stomach. There's 4 quadrants, so I'd look at all 4 depending on the deficiency that I'm looking for. And just by assessing the sounds of the bowel and seeing if I can hear any weird noises or air in places that there shouldn't be. Also, you want to check and see if the patient's abdomen is distended and firm, because if it is, it shouldn't be that way. So that could also be an indication of something that may be wrong with their GI. Lastly, if available, I would have the patient do a grip assessment. So I would have her put her arm in a 90-degree angle and hold the grip assessment for 5 seconds, squeezing it. And I had her do it 3 times on each arm, and then take the averages and see what her mean is to assess her grip strength and just if she has any issues with that. So that would be the whole assessment from head to toe. And yeah, thanks for watching.